Dear Chair, dear audience, I would like to present you my thesis titled New Insights into the Accuracy of Fixed Dentures. My name is Mirjam Kisgergely. I'm a first-year PhD student and also a dentist at the Department of Prosthodontics at Semmelweis University. My vision is to provide longer-lasting dental restorations to patients, and my mission is to explore the ways to produce more accurate fixed dental prostheses. Currently, I have two ongoing projects, and my main goal is to compare different dental milling machines. The title of my first project is Comparing the Accuracy of Dental Milling Machines in Fabricating Fixed Dentures. There was a study in 2007 in which they found that 94% of crowns had poor marginal fit, which is predisposing to failure. This means that 94% of these teeth restored with crowns are more prone to develop, for example, caries or periodontal diseases, which with time can lead to tooth loss and eventually even edentulousness. When we want to make dental restorations, we always have to consider quite a few aspects, and one of the most important is accuracy. We always have to determine the appropriate dimensions of a prosthesis to be able to make long-lasting ones, and this clinically accepted accuracy is around 100 micrometers. So how can we make these crowns? In an annual report of 2013, we can see that 75 to 80% of crowns were still made manually and only the rest by computer-aided production. The problem with this is that these handmade crowns mean a slower production. It is unrepeatable because the technician designs it by hand, which leads to human risk factors such as inaccuracy. So what is the other option? Is the so-called computer-aided design and manufacturing. It ensures a faster production, it is repeatable because all our data are stored on computers, and it is also accurate. And these CAD/CAM systems can be divided into two subgroups, one of them being the in-lab, which means that we still have to send our works to the dental technicians. Therefore, it requires multiple dental appointments, but it is considered accurate. The other one is the so-called chairside system, which means that everything happens at the dental clinic. It also allows us the concept of same-day dentistry, which means that patients come in and can leave on the same day with the final restoration. The question arises whether this fast production can result in accurate dental restorations. Therefore, we aim to compare the accuracy of dental milling machines in fabricating fixed dentures. Our clinical question is that how accurate chairside milling machines are in fabricating fixed dentures, and we use the PICO framework, where a population is milled single-unit restorations. Our intervention is different chairside milling machines, and our comparator is different lap-side ones, and the outcome is accuracy. And we hypothesize that chairside milling machines can produce fixed restorations as accurate as the lap-side milling machines. And also our implication is to provide patients with CAD/CAM fixed dentures milled with the highest accuracy. So in the beginning, after the finalization of my search key, I've downloaded a little above 13,000 records from 4 databases. And after the title abstract and the full text selection, I had 232, adding the 4 articles from citation chasing. Now I have 236 in total. Currently, I'm at the phase of data extraction, where I'm at 29% currently. The title of my second project is Comparing the Accuracy of Dental Milling Machines in Fabricating Crowns, which is an in vitro study. During our everyday practice as dentists, when a patient comes in with a problem, we usually have to make temporary restorations before the final one. Why is that? Other dental treatments are sometimes needed, or aesthetic problem can occur if the front region is affected, or the chewing function needs to be restored. One of the most important factors is that even this temporary restoration needs to be accurate for long-term success. As I've mentioned before, when we want to make restorations digitally, we have 2 main ways, the chairside and the lap-side one. The advantage of the chairside milling machine is that the restoration can be ready immediately, while for the lap-side one, we have to wait approximately 1 week. The problem is that we do not know for sure whether this fast production or even the simpler software of the chairside milling machines allow us to fabricate restorations that are the same as the original design, thus being accurate. Therefore, our aim is to observe the internal surface accuracy of the lap side and the chair side milled restorations. Our clinical question is that how accurate chair-side milling machines are in fabricating crowns, and we again use the PICO framework, where our population is the milled crowns. Our intervention is a chair-side milling machine, and we compare it to a lap-side one, and our outcome is accuracy and time. And our hypothesis is that chair-side milling machines can produce these crowns as accurate as the lap-side ones, and our implication is basically the same as it was before. So in this slide, you can see that the method of this study starts with the virtually designed restoration, an upper central incisor. We will send this data both to the chair side and the lap side milling machine and mill it with each. After the fabrication is done, we will get these crowns you can see in the pictures. And we will use a scanner to digitalize them, allowing us to compare them to the original design. And this comparison will be made by superimposing the two data. Here is our outcome, which is accuracy. It is made up of two components. One is trueness, which means that we project the STLs of the group's elements onto the reference one by one, and the program will give us the values for each. Also, we have precision, which includes measurements within a group. And as an evaluation, the program will give us values such as root mean square, standard deviation, or average. As for secondary outcomes, we would also like to measure the time needed for the milling procedure and the amount and type of waste material generated by the process. Here you can see a timeline. We are currently at the phase of the sample size calculation. We would like to finalize it this week. And after it is done, we can start to order the necessary items for the investigation and start the actual process. So in summary, I have two projects currently, which I plan to submit later this year, both of them. So I would like to end my presentation with a quote from Carl Sagan, that somewhere something incredible is waiting to be known. Thank you for your kind attention.
Thank you for your great presentation. My question is regarding your second project. Are you planning to extend this research, for example, for other types of dentures or materials?
Thank you for your question. Yes, we would really like to expand this investigation because I think it's a really important topic. We talked about it, and if we can, we want to see other milling machines included, especially chair-side ones, but also we would like to see more materials, because currently we are investigating a temporary one, so it would be good to see a definitive one. And also, as you were asking, so now we are preparing an incisor, but it would be interesting to see the results if we prepare and make crowns for premolars and molars as well.
Thank you for your answer.
Thank you very much, Mojtaba.
Congratulations for your nice presentation. Regarding your first topic, I wanted to ask if you made any differentiation between the type of the machine, because to my best knowledge there is wet milling and dry milling. So
thank you for the question. I'm registering all the data according to that as well. If the article is mentioning it, then I'm collecting it. There are a huge amount of different milling machines, and also the software they are using it with. So we need a lot of subgrouping here, in my opinion. Because we not just categorize according to the milling machines, but also different types of restorations, because all the single unit restorations are included in this study as well. So yeah, we need to consider quite a few aspects, yes.
Thank you.
Thank you.
Thank you very much. I need to ask one question.
do you have enough data to consider for the first project,
yes,
for the in-lab and chairside milling machines, how the cement thickness was set before the milling when the planning was done? Can you consider this? Because I think it will make a difference in the accuracy of the outcome.
Could you repeat that part of what the thickness, the restoration?
Cement thickness.
Cement, yeah. Yes, it can make a huge difference, and most of the articles I've screened and they extracted the data from 68 or 9 currently, and most of them mention the cement thickness they are working with, and also some papers investigate different cement spaces with one milling machine and one material. So definitely I'm recording that, and we consider that as well.